Welcome to Infection Prevention and Patient Safety. The purpose of this discussion will be to review basic infection prevention practices, discuss your role in infection prevention, identify infection prevention resources available to you. There are 5 moments for hand hygiene, and we'll go through all 5, which beginning with number 1 is always before touching a patient, 2, before a clean aseptic procedure, 3, after body fluid exposure risk, 4, after touching your patient, 5, after touching patient's surroundings. How to use standard precautions, not random precautions. Because patients don't come with warning labels, such as you see here, we have focused on 3 major elements of standard precautions. The first one is always hand hygiene. 2 is disinfection of equipment with a wet time for peroxide and bleach wipes of 3 minutes. Number 3, the appropriate use of gloves. Wear gloves if you're having contact with blood, body fluids, or contaminated items. Gloves are not a substitute for hand hygiene, and gloves should never be worn in the common areas such as elevators, hallways, etc. Protect yourself. EHS bloodborne pathogen policy. Eating by HCWs is restricted to the staff break areas and the cafeteria. Drinks. Departments may establish a designated clean area for drinks such as water and coffee for easy access by staff. Area must be clearly labeled clean area where there is no handling of blood, body fluids, contaminated equipment, or medical records. Pose no risk for occupational exposure to blood or body fluids. Isolation precaution. The patient in the next bed is highly infectious. Thank God for these curtains. This is a prime example of touching other surroundings in the patient's room. The type of precautions that we have are transmission-based precautions such as airborne, droplet, contact, enhance, C. diff, and then pediatric respiratory. And these will be covered more in detail in your EOL modules. Protective neoprenic precautions is a modified version here at EHS. The airborne precaution sign that would be on the door of the patient's room is anyone entering this room must wear an N95 respirator, and doors must remain tightly closed. And patient transport, patients should wear a surgical mask while they're being transported outside of their room. Droplet precautions, anyone entering this room must wear a surgical mask within 3 feet of the patient. Do not use an N95 respirator. Patient transport, patients should wear a surgical mask. What's the difference? Contact precautions versus enhanced precautions. For contact precautions, anyone entering this room must wear gloves and gowns if there is a risk of clothing contamination. Visitors do not wear gloves or gowns but must wash their hands when leaving this room. During procedures, patient exams, changing linen, transferring a patient, holding, or other types of direct patient care. For enhanced precautions, anyone entering this room must wear gloves and gowns, no exceptions. Visitors are not required to wear gloves or gowns but must wash their hands when leaving this room. C. diff precautions. Anyone entering this room must wear gloves, a gown if risk of clothing contamination. Please wash your hands with soap and water and use bleach to clean. Visitors do not wear gloves or gowns but must wash their hands when leaving this room. And again, this is going to be during procedures, patient exams, changing linen, transferring patients, holding, or other types of direct patient care. Pediatric respiratory precautions. Anyone entering this room must wear gloves and a mask within 3 feet of the patient, a gown if at risk of clothing contaminations. Again, visitors do not wear gloves or gowns but must wash their hands when leaving this room. Isolation questions. If testing for contagious illness such as C. diff, flu, TB, isolate. Family and visitors, offer them the PPE, but they're not required. Patient and family education, document teaching. C. diff is testing policy 8304.230. They must have at least 3 diarrheal stools in a 24-hour period. Do not send a formed stool. Send only 1 specimen to be tested for C. diff. And before testing, evaluate the patient for other causes of diarrhea, recent laxatives, a GI prep, 2 feeds, and including fever with an increase of a WBC and abdominal pain. And this is the site where you would be documenting the above for these items here. Preventing central line associated infections for CLABSIs. They should always be covered. The staff member that is going to be putting the central line in should also be gown, glove, surgical mask, and cap to prevent infection. Insertion checklist bundle on all insertions, complete in the EPIC LDA. The line maintenance, scrub the hub, use alcohol port protectors such as the dual cap. Dressing changes, use bio patch on non-antimicrobial central lines for PICS, cordis, and ports, and all femoral lines. At Barreras, IV team is responsible for routine dressing changes, central lines in the adults. Daily review of line necessity is a prompt removal. Blood cultures, 2 peripheral sticks recommended, and if a physician orders a line draw, contact your IV team. This picture here is a sample of the culture of an IV needleless connector. This picture on the left is before the alcohol swab, and then after the alcohol swab. Catheter-associated urinary tract infections, CAUTIs. There is a nurse-driven protocol for Foley removal. Nursing policy states adult patients only, nurse-driven removal of urinary catheters. Access the patient each shift for possible urinary catheter removal. Remove the urinary catheter within 2 hours of a shift assessment unless one of the following situation applies. The patient is healing from a stage 3 or 4 skin breakdown, perineal or sacral. Patient has an epidural. Strict hourly urine output monitoring is required. The patient has acute urinary retention and urinary obstruction. The patient is here for end-of-life care. Add a urinary cath is requested for the care and the comfort, and or urology or transplant patient. A physician has to complete a urinary catheter order set. This must be renewed every 2 calendar days. If there is a continued needed care for urinary catheter, a nurse documents the indicator for continuation in the shift assessment. If the urinary catheter is removed, document the date and the time in the electronic patient notes that the urinary catheter is removed. Validate that patient voids within 8 hours, and if no void within 8 hours, refer to the bladder scanner urinary retention nursing policy PC-221. The nurse-driven protocol for Foley removal. Use the nurse NDP, evaluate the need every shift, and remove if the criteria is not met. A physician order is not required for this. Secure the catheter and keep it below the bladder. Additional tools, condom caths, bladder scanner, external female catheters such as the PureWick. Always document removal of the catheter in EPIC. To prevent the UTIs, question every Foley before the patient is transferred to your unit. Does this patient have a Foley? Is there a reason for the Foley? If not, remove the Foley before transferring. If the Foley is needed, the urinary catheter standing order set must be completed by the physician and renewed every 2 days. A verbal order is not acceptable for the Foley order set. surgical site infections, SSIs. The impact of SSIs is a burden of 2 to 5% of surgical patients develop an SSI, and which means approximately 500,000 SSIs are noted in the U.S. annually. The outcomes can be from 7 to 10 days of additional days, 2 to 11 times higher risk of death, 3,000 to 30,000 excess costs per SSI, 10 billion annually in excess costs. SSIs are preventable, and with the best practices such as the chlorhexidine bathing, remove all hair only when necessary using clippers and not razors, appropriate prophylactic antibiotics, control their hyperglycemia, appropriate incision wound care, and education of the patient and their family. VAP prevention. The epidemiology of a VAP is the most frequent HAI seen in ICUs. There are greater than 100,000 cases annually in the U.S., and it accounts for more than 1/2 of the antibiotic use in the ICU. Attributable mortality is high as 50%. The prevention strategies, you have a VAP bundle, which includes the elevation of the head of the bed for 30 degrees, mouth care, brushing the teeth twice a day, especially intubated patients, sedation vacation, and weaning parameters. And if you have any questions, you can go to the internet for Erlanger under the document libraries, and you can go down all the way to, you see, the infection prevention library, and any additional information you will be able to find there, as you can see. And then once you click on it, it gives you all this data, so you can see what training, what additional information you may need. And of course, you can always call extension 7239. We're there to help you. And policies, quick references, and patient education materials are available on the internet. And you also can contact the patient flow coordinator, which is the house supervisor, after hours and weekends to be reached for the infection prevention on call. Thank you.